people, who could recite the telephone book, and he would find a meaningful way that was creative to do it, and you could have a transcendental experience just because he was so aware, so present, and so unique. So man's search for meaning among readers, when a poll was done in the Library of Congress among readers, what is the most influential book you've ever read? The Bible, of course, was first, but Man's Search for Meaning was 6th or 7th as being one of the most influential books that people have ever read. And it describes his logotherapy, how he went from being a professor of neurology and psychiatry in Vienna to being threadbare in the concentration camp. Right. And went through a series of concentration camps and only survived because he just happened to be lucky. Right. And how when everything was stripped away, he could still determine his attitude. He could still determine what was meaningful to him. And so he's a very wise, inspiring public figure and a psychiatrist, and one of the people whose thinking has been tremendously influential to a lot of psychotherapists, me especially. So there's actually a website on Old Dominion University where they are recording an oral history about psychotherapy, and I recorded on that Old Dominion University site some of my recollections of Carl Rogers and Carl Whitaker, and also Viktor Frankl, also Milton Erickson.
Back a few minutes ago, before I interrupted you, you were going down a list of the different approaches to therapy. You had mentioned psychoanalysis, and can we come back to that again? And then I'm very interested in how you integrate all of these into the evolution of psychotherapy. I can't think of anything more relevant to humanity than the evolution of psychotherapy. So anyway.
When I organized the first Evolution Conference in 1985, we had 7,200 people who came. That was to celebrate the 100th birthday of psychotherapy. Psychotherapy was 100 years old in 1985. So I invited people like Virginia Satir and Carl Rogers and Rollo May and Bruno Bettelheim, and they came. Now I watched as Carl Rogers, in my suite, in a pre-conference meeting, he was 83, and he walked over to Joseph Wolpe, who was the great leader in behavior therapy. So you had the titular leader of humanistic therapy and the titular leader of behavior therapy. They walked over to each other and they said, I guess we've never met before. And Wolpe said, well, I guess we haven't. And so at that time in the evolution of therapy, it was like, my school is better than yours, and my approach is bigger than yours, and my approach is more influential than yours. And people were more jockeying for position. Well, I hope that partly as a result of these evolution conferences, where we brought these great leaders together and they had to talk to each other for the first time.
Right. I mean, I can relate to that. I remember a psychiatrist once telling me that I think Benjamin Rush, the founder of the American Psychiatric Association, that there were several other people on the board there that were at the original meetings, and they had never uttered a word to each other because they all had their ivory towers. Exactly. And they, their school was the school, and your movement is the opposite of that. It's taking the best and bringing it together.
Yes. So even though we have the Erickson Foundation, our primary role, we want to promote the work of Dr. Erickson, but our primary role is also to speak to the commonalities that underlie successful clinical work. That psychotherapy integration is much more important, because what we want to do is to be able to help people in the quickest way possible. And so it's not, it's trying to find from people, from the patient, what is it that works for you? What did we just discuss today that really worked for you? And to build on that. And if that requires using some psychoanalytic excavation, or that requires some behavior modification, or that requires some humanistic I-thou relationship, or that requires a systemic approach, or that requires creating experiences in which people will realize a new identity by virtue of moving into different contexts, it is my hope that psychotherapists begin to pull from the best of the best and make it applicable to what is needed by the patient, so that the patient's predilections determine more of the direction of psychotherapy rather than the patient is fit to the Procrustean bed of a hypothetical theory of human behavior.
Right. Just something that's just came into my mind is recently. I mean, there's a certain interface between the medical community and the legal community, and the issue of divorce and parent alienation syndrome. I can think of a little girl recently whose father died, and she was feeling bad, and apparently her mother put her in a mental hospital, and she was put on heavy dose of Zoloft.
Oh boy.
And isolated from the grandparents, and then the legal system comes in, and in these kinds of situations, or in a custody battle, they alienate, the children and the parents even further. And this seems to be like a systemic problem across the board.
Big problem.
Do you have any comment or?
Everybody seems in those cases to be acting with good intentions, and the road to hell is paved with good intentions. So rather than understanding what is the bureaucratic protocol that's important to follow, we need to be looking at the outcome. And the overuse of medication and the overuse of the strictures within the social system may unfortunately have deleterious effects. There's iatrogenic effects. Iatrogenic means that the problems are caused by the doctor, but the problems could also be caused by the social system. So, to me, it's really easy. Do whatever you can to keep families sane and together, and to working as a unit in behalf of the family. And sometimes those values get distorted, and
what frequently
problems.
What frequently happens is the attorneys ally with therapists who are not of a family orientation, who will identify the child
right, because their rules are protect the child, and when you have to protect a child, these are the procedures that you go through to protect the child. And the philosopher Santayana said somebody comes up with a good idea and somebody else is sure to overextend it. So we need to look at that sinusoidal curve about too much intervention and too little intervention, and to be able to bring things back into a more moderated place where the essential values of growth and development and family orientation, those are what is really important. And everything that we can do to keep families robust and to keep families together, that's good and true and wise. And sometimes the exigencies of the legal medical system have their own priorities, and those priorities, because they're written into law, they take precedence, and so then we have more problems that are
tough
created.
situation.
It's not really my area, so I can only comment on that.
Well, Dr. Zeig, our time is running out, and I just wonder. I'm not sure where to go. I want to get back to this thing. I mean, that you're traveling around the world like Johnny Appleseed,
Yes.
spreading these seeds
Yeah.
of a whole new approach to mental health,
Yes.
to emotional health,
Uh-huh.
that includes the best of all the different streams, if you will, coming into this river
Yeah.
of therapy. And can you just describe that a little bit more, because this is so foreign to myself and many people. How do you bring these systems together?
Well, I think that it's not me. I think that the common therapist on the street is recognizing that slavish adherence to doctrine is not the royal road to happiness. And,
Slavish adherence to doctrine is not the royal road to happiness.
no. And so the therapists want to help their patients, and they're looking for, it's a difficult job being a therapist. They're looking for inspiration, they're looking for new methods, they're looking for new approaches, and psychotherapy has to continue to evolve, like art has to